So please introduce yourself.
I'm Dr. Carl Rimmele. I'm a clinical psychologist. I've been trained in working with pain and currently work with folks who have had both childhood and adult trauma.
What are the immediate psychological effects of female genital mutilation?
I think the first, at least what the data show, is that the first signs are pain, betrayal, shock. The girls aren't warned about the procedure or what to expect in advance. This betrayal certainly affects their ability to manage stressors as well as medical issues later on in life.
What are the long-term effects of female genital mutilation?
Well, I mentioned before some of those factors of anxiety, post-traumatic stress issues. Women and girls who have experienced female genital mutilation typically have higher rates of anxiety and post-traumatic stress disorder than their peers. Certainly the rates are at about the same as you'd expect in victims of childhood abuse. I think some arguments have been put forward that there's some cultural norming that goes on that somehow protects these girls from the negative effects. And it's very clear that if that were the case, then you wouldn't expect to have the same incidence of anxiety and mental disorders that you would have from childhood abuse. So it's very clear that despite cultural norming, there's no protective factor from that.
And what drives a culture to perform this act?
Well, it's difficult. That's kind of beyond my scope in some ways, but from what I understand of what I've read, that there certainly are both cultural and financial incentives. There's a study that showed with Kenyan women, the report is that there's significant financial incentives for the parents to have their daughter undergo this procedure. The size and even the presence of a dowry depends on the girl having had female genital mutilation imposed upon her.